Good day, East Hampton, West Hampton, Bridgehampton, Southampton, Sag Harbor, and community. Welcome and thank you for tuning in to Café with Sandra K. September is a glorious time in the Hamptons. The ocean surf is warm. The beaches, they're vast, they're clean, and they're beautiful. The sunsets are ablaze with hues of oranges, pinks, and blues. Butterflies are in the air, and pumpkins, apples, and grapes are ripe for picking. The beauty of Mother Nature is sure to bring a smile, which brings me to my very special guest today, Dr. Joshua Weiler.
Thank you.
The Hamptons dentist, who is sure to bring you a healthy and a vibrant smile.
Thank you very much. It's great to be here.
Thank you, Dr. Weiler. I'd like to start, because you have a very interesting history, I'd like to start by asking you how you discovered your passion for dentistry and how it evolved.
Well, my passion for dentistry started a little bit later than most, I think. I went to college for studio art. I pretty much went straight to portraiture. I really was very driven, very drawn to the face, facial aesthetics, proportion, and that kind of led me into looking more into working on actual faces instead of just drawing them.
And you're artistic and creative.
Yep, and that actually really, it really panders to dentistry quite a bit.
That's great, wonderful. What would you say are some of the latest dental advances today?
Dentistry is always evolving. Every day it's like there's something new. Materials are getting better, more aesthetic. Dentistry is much more about aesthetics these days. There's less metals in the mouth. There's better materials, stronger materials to get past the need for metal in the past. And then there's digital dentistry. So there's a lot of design that goes on, digitally on the computers through digital scanning instead of, using impression materials. It's more accurate and it leads to much better results.
And dental lasers, what is that all about?
Laser dentistry is used for many different things. We use lasers a lot for, gingival health, recontouring the gum tissue so that you can get crowns and veneers and aesthetics perfectly in the right spot. It added a very easy way to do things that used to be surgical procedures.
Very nice. I'd like the audience to see what a day in the life of the Hamptons dentist is. Let's take a look at the video.
It's not just about fixing a tooth, it's about giving someone a healthy smile. Our priority is to care for our patients. We want to make sure that they're in the safest environment and that they're taken care of. We're available 24/7. When we're not in the office, the calls are transferred to our phones, and if we miss a call, we're back at you in about 5 minutes.
I had a broken tooth, so I called their office and they had me come in the very next day.
I did have an emergency on a weekend. I was surprised how fast they got back to me.
From hygiene visits to full mouth reconstructions, we provide services that are tailor-made for each patient. Anything that you need, we can do.
Dr. Weiler was really good about giving me advice. He did a great job with scanning my teeth and got the bridge put in on one side, and it looked exactly like my teeth.
We incorporated a lot of new technology to our practice. We have a very friendly team at the Hamptons Dentist.
I like that the staff all gets along together.
Our team is like a family, and when you come to our practice as a patient, you'll leave as family.
Well, that is beautiful. Great. Beautiful, beautiful video, beautiful office, staff.
Thank you very much.
I love your the fact that you're so family oriented and warm. You can feel all of that.
Thank you very much.
You do mention in the video, there's a few things that are highlighted. Let's start with talking about preventative and treating dental hygiene. With examples of, you speak about crowns, for example, and dental implants. Can you speak to us a little bit about
Sure, absolutely. Dentistry always starts with making sure there's a good foundation. A lot of times people don't realize, but the cleanings are super, super important to making sure that if you are going to build crowns, veneers, bridges, implants, anything that you need to do to replace or restore or enhance your teeth or your smile, it has to have a good foundation. So we use our lasers, we use our hygienists use all these different equipment that we have to make sure that the gum tissue and the bone is ready to handle these prostheses.
Okay.
After we do that, then we can start talking about the veneers, the crowns, all those materials and all those different ways that we can restore teeth, not only because of the way they look, but also they have to function. All diseased tissue has to be taken care of. We can't leave any cavity or anything like that because we want everything to last as long as possible.
Okay. When does one need a crown? What signifies the importance of getting a crown?
So crowns are important because now you can restore a tooth fully, full tooth instead of just like filling for a cavity when there's not enough tooth structure to hold that filling. So if more than a certain amount of tooth, depending on where it is in your mouth or where the actual cavity is in your mouth, if it's not going to sustain a filling anymore and it's going to be more detrimental to put something in your mouth that may crack or break or whatever it may be, it's better to do a full coverage restoration to protect everything.
Okay. And a dental implant?
A dental implant, that is for replacing teeth that are missing or have to be removed due to disease, fracture, trauma, whatever it may be. A dental implant is an artificial root that goes into the bone. The bone heals to it. It actually integrates with the titanium, which is why they exist. It's great. And then we connect a crown, just like we would do on a regular tooth. We connect a crown right inside an implant.
And there's a dental bridge. Is that implant bridge? Is that something that you...
So you can do bridges with, this is called an all-on-4, but you can do bridges that connect to implants, from implant to implant, or you could do bridges that connect from tooth to tooth. This would be a full mouth tooth to tooth one with 6 teeth holding in quite a few, about 8 to 10 teeth,
Very nice.
for a bridge. yeah.
Okay. And let's move on to a little bit about, well, before we go on, how do the elderly, what should they do in terms of controlling gum disease, for example?
So it's very important for the elderly to take extra special care as you get older. Your immune system gets a little weaker. Your body is not able to fight disease as well. Gum disease is the leading cause of tooth loss, and we want to make sure that everyone's able to keep their teeth for as long as possible.
Yes.
Gum disease is also directly related to heart disease. The bacteria that causes gum disease can travel through your bloodstream. There's a lot of bleeding in the mouth, especially when there's diseased tissue. So that's something that we want to make sure is under control, as well as the correlation to gum disease and diabetes. It's the same thing where there is just less of a healing process when you have diabetes. It causes more gum disease. It kind of goes hand in hand with each other. So you want to make sure everything is controlled as possible.
Great. And how often would you recommend someone has a checkup and a cleaning?
Depending on the health of their tissue, it can range anywhere from every 3 months to every 6 months. If we find that there is gum disease, if there is tissue that needs to be kind of stabilized and needs to be checked on more, then we recommend every 3 months. And then if you have healthy tissue, we always recommend 6 months to come in for your cleanings and just to make sure that everything is still doing well.
Great. And oral screenings now.
Yep.
Is that something that you do in your office? Is that important
Yes.
today?
Oral cancer screening is very, very important. We use a scope pretty much that will show us irregular tissue. We recommend it at least once a year. Every 6 months would be great. We want to catch things. These scopes are so advanced they can catch precancerous cells or malignancies. So it's very important.
Is that something that you can detect right away when checking on a patient?
Sometimes, if we see the irregularity, we check up on it, we follow up with it, and then if it looks like something that needs to be biopsied, we send it.
Okay.
And we just make sure. Sometimes it's just better to be safe than sorry.
Yes. And in terms of dental health care of cleanings and flossing, could you speak to us a little bit about that?
Yeah, just like just like coming in for your cleanings, we can do 1% of the work. We do the cleanings, but you go home with your mouth. And it's up to you to make sure that you maintain the health of the gums. So flossing is extremely important. Water flossing, I always recommend water flossing. I think it's a great, not alternative, but an adjunct to flossing. And of course, brushing twice a day.
And how do you go about with the water flossing from the new equipment that is out, using that?
Yeah, you can buy water flossers pretty much anywhere now. You can buy
Okay.
cordless ones that you can bring in the shower so that you don't have to clean anything up, because that's usually what deters people from it.
Okay.
But it is a very, very easy thing. I highly recommend it, especially when there's a lot of restorations, implants, bridges, where you can't really floss very well.
Okay, very good to know. All right, let's talk about cosmetic
Sure.
dentistry, which is obviously we're all trying to maintain our youth and beauty. And so let's first speak about veneers.
Okay, great. Veneers are a very nice way to enhance your smile. When we talk about youthful smiles, trying to fix maybe what kind of went wrong over time in life, chipping of teeth, misaligned teeth, even sometimes, you can fix things with veneers. Veneers are like porcelain jackets that go on top of the tooth. They don't cover the entire tooth, but they're very minimal prep, and they can really pop your smile. They can change the shape of your teeth. They can fix slight misalignments, and they're great. There's an example of a veneer right here, which is probably very hard for the audience to see, but it's pretty much a shell that goes on top of the tooth.
Very interesting. Okay.
And it's
And are
usually
you
made out of
finding more
porcelain.
and more people are
Yes.
taking advantage of veneers?
Yes, for sure. We also use clear liner therapy, some like Invisalign or those companies. We can use those materials to straighten your teeth. Sometimes patients don't necessarily want to go through an orthodontic procedure, and there are cases where you can use veneers to straighten teeth.
Okay.
It's very case by case, but it's a nice alternative.
Is there any downside?
Yes, there's always a downside. Everything in dentistry, we're always balancing the pros and cons of doing treatment. If you do a veneer, we have to create space for a veneer. You're doing a crown, we have to create space for a crown. We have to remove enamel to create that space. So we are damaging part of the tooth, but then we're covering it up. So again, if you have good oral hygiene, if you keep up with your cleanings and your checkups, and we're able to preventatively keep your mouth very, very healthy, then it's a good treatment. But if you are a patient that does not, then it may be detrimental.
Okay. And what about whitening and lightening and brightening?
Yeah. So tooth whitening is very, very, very common. Everyone wants their teeth to be as white as possible. We use systems that they whiten the inner layer of your teeth. The inner layer of your teeth are yellow. That's the dentin, the dentin layer, not the enamel. And what the whitening solution does is it whitens the inner layer, and it pops your teeth. The blue lights that you see usually with the whitening, that's an activator. It activates the solution to go, a little bit stronger, or a little quicker, sorry. And usually the results are very, very nice.
Okay. And are you finding more and more people are coming into your office for that?
Yes, for sure. A lot of people, they want to get a checkup, exam, cleaning, and whitening. And that's fine. As long as there's no
Okay.
diseased tissue, there's no cavities, there's no sensitivity, that's fine.
And at-home care, do you find that people are taking advantage of that as well, or?
Sure, we do, most offices, but of course we do an in-office treatment, and then there's also the option to do a take-home treatment where you get your own blue light, you get your own solution, you can replenish it as needed, and then you can kind of keep up with it as much as you want.
Okay, great, very nice. Yeah. And speak to us a little bit about Invisalign. What is Invisalign, and when is it used?
Sure. Invisalign kind of took over orthodontics. It used to be bracket braces with the brackets on your teeth and then the wire that goes across, and you have to see the orthodontist every few months, or every month or so that the brackets can be tightened, the wire can be tightened, everything, then they move your teeth for you. Invisalign is great because they're clear aligners. This is an example of it. So it's clear aligners that you can take on and off yourself. And when you're going through your treatment, you get a series of these aligners, and every week or every 2 weeks, depending on your treatment, you switch the aligners and they do little movements to your teeth to put them in place. It's a great alternative to regular braces. You know, a lot of people don't want silver brackets on their teeth anymore. And I find it to be a little less painful than,
Is this
brackets.
used during the day or
It's
at
used for
night?
22 hours a day.
22 hours.
Yes, so it is
That's
in
quite a lot.
all day. So you have to make sure that you're going to be compliant with it.
Okay.
Because it's a big undertaking, and you don't want to,
And how
waste
much time do you have to devote to having Invisalign
That's
on your
case
teeth?
by case. So depending on the movements that we have to do, how crowded the teeth, how much spacing there is, if we're moving teeth through cross bites, meaning the teeth are misaligned, through the bite. Depending on what we need to do, the amount of aligners, which dictates how long the treatment is completely unique to each patient.
Is this more utilized by teenagers, or are you finding now the
Everyone.
population?
Everyone.
Everybody wants their teeth to be straightened and looking good.
Nobody wants metal. So everyone wants to move their teeth into the right spot without having to put braces on. And this is how it's done, and it works very, very well.
Okay. Now, in terms of cavities and fluoride treatments,
Mm-hmm.
are you finding that people today have less cavities because of the advances?
I do see that younger people are getting less cavities.
Okay.
Even though there are, there's a generational thing where a lot of the older generation had a lot of silver fillings. Those kind of, over time, while they're great, over time they can break your teeth. You can get cavities under them, and it's hard to see them on the x-rays, so it's hard to diagnose.
Mm-hmm.
But I do find that in the younger generation right now, if there's good home care, then there is less cavities.
Okay.
And there's less reason to drill and fill.
That's great. That's great. I'd like to ask you about, for the past year and a half, we've obviously had the COVID
Sure.
pandemic. How did that affect your business?
It was an interesting time. We closed our office for about 10 weeks during the lockdown. I did see emergencies, only emergencies though, and a lot of people moved out to the Hamptons from the city, and there were a lot of dental emergencies. So I was fairly busy, seeing emergencies during that time, and while it exposed me to a lot of new people, we did have to take the precautions so it didn't expose us, me and my staff, to the virus itself. And luckily, thankfully, we got past it without any issues at all. We did renovate our office to catch up with, the higher, the higher demand for, infection
Sure.
control, and
Right.
pretty much just keeping, the office and any airborne viruses or anything like that at bay. So we did install, HVAC, something into our HVAC to make sure that the air is filtered all the time. We were using a fogger. Everyone was wearing N95 masks, which we still do. But that being said, dental offices, even before COVID, were very, very in tune to infection control, and which started usually, in the 90s when the AIDS epidemic was. And most dental offices were very prepared from the start to deal with COVID. We always wore gloves, we always wore masks, we always used suction in the mouth, but now it was just kind of a little bump up.
Okay,
And thankfully we haven't had any issues yet.
great. Well, I know we have another video to take a look at
Sure.
to show the precautions and what you did during COVID and what
Sure.
is still happening.
Absolutely.
So let's take a look at that video, please.
We've taken COVID-19 very, very seriously here. The safety of our patients and our staff is our #1 priority. Patients are screened before they come in. We take their temperature. We've added an award-winning air purifier that's in our HVAC system. We've added air filtration systems to each unit. We've also added a fogger to disinfect the rooms between patients. Each of our clinical staff has been provided with N95 masks. Everybody leaves their scrubs here, and everyone leaves their shoes here so that it's not contaminated by the outside environment. The protocols that we did put in place are for the safety of our patients. However, we do look forward to a time where we can greet a patient with a visible smile and a handshake.
That's wonderful. That's great.
It's true. I can't wait to be able to take the mask off and smile at patients and see all those beautiful restorations we put on their teeth.
Ah, that's great. Well, hopefully sometime soon.
Yep.
Yes, sometime soon. And would you say that life is, other than the mask, the population at large is coming back to the office now?
Yes. With the vaccine, everyone's a little bit more comfortable.
Okay.
I think it's been a little bit better, at least in terms of what I'm seeing. Everyone's a little bit better about it these days than they were about a year ago.
Okay.
But you know, we're still taking those precautions. We're still making sure that everyone is safe.
That's wonderful.
Yeah.
Great. And in terms of future goals for yourself, if there are any, what might you like to share about what you hope to see happen in the future?
In terms of my office, I want my office to grow. I would like to expand outwards. I would like to just, you know, keep a steady pace, you know, going. I really try to keep up with all of the technology. So I plan on, of course, you know, upgrading all my materials, all my equipment as needed. And we really just try to do the right thing for our patients. And that's just a tradition that we're going to keep going.
That's great. Well, you can feel it just by talking to you and seeing you.
It's a great field to be in, and you help people who need help, you fix problems that need to be fixed, and it's very fulfilling.
That's wonderful. I know that you also have a family life.
Sure.
Yes, you have a lovely, beautiful wife and 2 children and a dog.
And a dog, a puppy named Coco.
A puppy named Coco. And I know that you're not a vet, but is there anything you do in terms of Coco and looking out for his teeth?
Coco's a she.
She, okay.
It's okay. But yes, we brush her teeth. I've been exposed to a lot of dogs that have had their teeth taken out, and that kind of freaks me out a little bit, so we do take care of her teeth. You know, I have 2 young sons, 3 and 4, and you know, you have to, you know, just for parents out there with young kids, you have to supervise. I have a lot of friends of mine who have young kids that always like to pick my brain about the situations that their children are in, and everything is preventable. And you know, cavities on young kids, you have to supervise. Brushing, you have to supervise their eating habits and diet, and you know, whatever.
Great, great. Anything else that you might lastly like to share with the audience at this time?
I mean, as someone who's fairly new to the Hamptons, you know, since I started working out here and I had my practice out here, I just think that this is the greatest neighborhood and the greatest area of New York. And the patients here have been absolutely amazing, and they've helped me build a very, very, very nice practice that it's my happy place.
Ah, that's beautiful. That's really beautiful. Well, thank you so much, Dr. Weiler. Really
Pleasure, thank you.
Pleasure having you here with us. A pleasure to have had you teach us and instruct us on
Sure.
everything that's happening in dental healthcare today, and obviously the protocols that you have put into place in your office are fantastic
Thank you.
and amazing. So we thank you, and I'd like to just thank LTV and the staff. And up next, everyone, we have Brad Boxell, the treasure hunter of Long Island. Stay tuned. Thank you again. A good day to all.